Signs and symptoms of urinary tract infections and what to do. The urinary system is responsible for excreting waste materials, excess salts, and water out of your body. It includes kidneys, ureters, urinary bladder, and urethra. If an infection occurs in any part of the urinary tract, it is termed a UTI. Urinary tract infections are commonly experienced by millions worldwide. Women are most affected by UTIs. In extreme cases, the infection may spread to the kidneys. Bacterial and fungal infections are the most common causes of UTIs. With prompt treatment, these infections are easy to resolve. Having a sudden and persistent urge to urinate is a common symptom of a UTI. Urinary urgency is a sudden feeling of the desire to urinate. It is not controllable and occurs due to the sudden contraction of the bladder's muscular wall. Urinary tract infections often result in involuntary muscle spasms in the bladder. The exact cause of these spasms is unclear. However, these spasms and contractions cause a sudden or persistent urge to urinate. Burning urination is also one of the most common symptoms experienced by people having a urinary tract infection. UTIs cause frequent involuntary bladder contractions, making you urinate more. This results in the irritation and inflammation of the urinary tract. Thus, when urine passes through it, you feel burning pain. Frequent urination in small amounts may indicate a urinary tract infection. UTIs are often problematic when you have a busy schedule because you have to urinate after every few minutes yet remain uncomfortable. This is because despite visiting the loo again and again, you're unable to empty your bladder fully. Urinary tract infections cause inflammation and swelling. This narrows down the ducts and limits urine flow. If you suspect a urinary tract infection, keep an eye on your urine color and form. The white blood cells present in the body help to fight against the infectious materials and are accumulated as pus, so cloudy urine indicates pus discharge due to the infection. This condition is known as pyuria and indicates complicated UTI or sepsis. It is more common in women than in men. People with a UTI also report having red or pink urine. The red or pink indicates the presence of blood in the urine. It occurs because the bacteria causing urinary tract infections inflames and irritates the surrounding cells and causes microvasculature to get damaged. Smelly urine in urinary tract infections occurs mainly due to a buildup of bacteria. During infections, the bacteria release certain gases like hydrogen, methane, and carbon dioxide. These gases are the main culprits behind odor formation. When the urine passes from the infected urinary tract, it picks this odor up, resulting in foul-smelling urination. Even though urine has an ammonia-like smell of its own, UTIs make it smell more pungent. UTIs are responsible for causing pelvic pain, most commonly in women. If you develop a urinary tract infection, you may experience pain and discomfort in the middle area of the pelvis and around the pubic bone. Inflammation and irritation of the urinary tract are the main culprits behind pelvic pain. Besides pelvic pain, UTIs can also cause rectal discomfort. This pain is more common in men with a urinary tract infection. Our body fights off foreign infectious particles in a unique way by raising its temperature. Therefore, when you experience a urinary tract infection, you may experience a fever with chills. High-grade fevers usually occur due to the infection of the upper urinary tract that involves the kidneys. Some other signs involved with the upper urinary tract include nausea and vomiting. Our body can resolve mild and uncomplicated urinary tract infections on its own without any medications. However, you should consult a doctor for a proper diagnosis and treatment plan. UTIs are diagnosed by performing urine tests or a urinalysis. With this test's help, the doctors take your urine sample and look for evidence of infection like white blood cells or bacteria. Besides this, the presence of nitrate in urine or a positive leukocyte esterase test supports UTI diagnosis. Another method used by medical professionals is a dipstick test. Though this test saves time and requires only a few minutes, its accuracy may vary depending on its standards. Therefore, experts recommend urinalysis. Depending on the symptoms, women require a pelvic examination as some pelvic infections can mimic a urinary tract infection. Males usually go through a prostate examination. Sometimes an imaging test may also be advised. This is because recurrent urinary tract infections may occur due to some underlying diseases like kidney stones. An ultrasound is used to evaluate the kidney and bladder. X-rays with contrast dye may be used to reveal abnormalities in the urinary tract. In some cases, cystoscopy is used. It involves inserting a thin and flexible tube with a tiny camera through the urethra to examine the cause of infection in the urinary bladder. Once the cause and type of infection have been diagnosed, your doctors devise treatment plans according to your symptoms. The treatment method is usually the same for both simple and complicated UTIs. In both cases, antibiotics are prescribed. However, the type of antibiotic, the dosage, and duration depends upon individual symptoms and circumstances. Your healthcare provider carefully chooses your medication depending on your condition and the type of organisms that caused the infection. If you get a urinary tract infection, some simple tips and tricks may help you ease the process. Staying hydrated is one of them. Studies have revealed that drinking water and staying well hydrated helps lower the number of bacteria and reduces future UTIs risk. Avoiding food items and drinks that irritate the bladder can also be helpful. These items include coffee, carbonated sodas, and alcohol. For pain and discomfort, you can use a warm water bottle for comfort. Try avoiding harsh cleansers and scented soaps, and make sure to follow good hygiene. With timely treatment, accurate medications, and these simple yet effective tricks, you'll be better in no time.